Welcome to Nursing Stories from the Heart. My name is Beth Matarasso and I'm joined by my friend and nursing colleague, Cheryl Burns. Together we acknowledge the traditional owners of the lands and waters from which we're speaking, the Turrbal and the Yuggera peoples, and we offer our respects to their elders past and present. As you listen to Nursing Stories from the Heart, we hope you'll be inspired to tell your stories too, because we know you have them. Welcome to Nursing Stories from the Heart. Cheryl, you're reading to us today from your Memoirs, Memoirs of a Matron. What story have you got for us today?
Well, I'm reading a story of hope, Beth, and I hope people can resonate with it. I recall a story about hope. When a person and their family enter a health service, one of the roles of the multidisciplinary team is to provide hope. It's actually a big ask when you think about it.
It is a big ask, yeah.
Strangely, this thought of hopelessness has come back to me every so often during my life. Patients need hope to heal. I'm sure you would agree.
Yeah.
I was working in a busy surgical ward as a second-year student. A patient was admitted. It actually seemed it's only like yesterday when that happened. A patient was admitted with a differential diagnosis of a tumour. They saw the team, had all the tests and biopsies in preparation for the surgery, all the tasks that we actually undertake as a team. The medical consultant was leading the conversations with the patient and their family. I had volunteered to be the primary nurse for this patient, meaning that I would consistently care for her each shift that I worked. I think that's very important for patients to have that continuum. Following surgery, the news was not good. The patient had an inoperable metastatic cancer. The consultant broke the news to the patient and family, and they were devastated, as you could understand. I was standing at the end of the bed with the doctor, and I could feel the energy drain from them following the news. It's actually quite daunting when you're actually the nurse, because you're the one that has to continue the care for the patient after they've received that news from the medical officer. Continue reading. I believe it's so important that the nurse follows up on the conversation the doctor has had with the patient so that they can allay any fears, answer any questions, provide comfort and understanding to the patient and the family. Following that, the patient developed complication and had an extended length of stay. When her surgeon walked past her room each day, she asked me one day, "Isn't the doctor coming to see me today?" Even though her life was ending, she still needed hope and comfort and to be recognised as a human being in a hospital. As she was my patient, I took a risk and told the surgeon her fears. After a discussion, he did not realise what had occurred. He thanked me for bringing this to his attention. The next day, I found him sitting by her bed, holding her hand and talking with her. I was so proud of him as he was so busy, but he took time for her to give her comfort and hope for whatever her future held. He was the head surgeon at the time. When I saw him, I thanked him for going out of his way for the patient. I utterly understood that it must be difficult for the medical staff to be able to go from patient to patient, provide the best care and the best coordination of care, and continue to give them hope. Either hope to recover or hope for a dignified end of life. It's a pretty big, it's a difficult gig, this.
Yeah.
I would often see him in the corridors of the hospital. And following that day of our discussion, he would always acknowledge me. My fellow trainees would say, "What have you got, Burns? He never talks to anyone." Only him and I knew that story, a story of hope. If we do not have hope, then what have we got, particularly in these vulnerable situations in life and in the health system? So that story, as we've said, we've all got stories within us, but that story certainly came to the front of my head when I was writing my memoirs.
And it's a beautiful story. When you talk about, I'll call it hope changes, and I think that we can. You gave two examples of hope to recover and be well in our life, or hope for a dignified end. And my experience has been that hope changes as a person's circumstances change. You might have some imaging done and you hope that it comes back okay, and if it doesn't, then you might hope that there's a treatment that you might be able to have, and if it doesn't, then you might hope that you'll get good care, or like it's constantly changing. And at the end, it might be that you hope you won't suffer. You hope that you will have people around you who love you. I also like in that story that, because I think we've shared before, that for people to hope is a burden. It can be a burden. It's a heavy load. As you were reading, I saw myself as a newly registered nurse in a room with a person who preferred to keep the blinds and the curtains shut. It was quite dark, and I can remember being in that room and listening to this person's story, and what I felt was an incredible sense of hopelessness. And I remember feeling like, and I think nurses often do, perhaps when we start out, perhaps it continues on, that we have to solve things, that we have to fix things. And I remember having an overwhelming sense that I didn't know what to do. Listening to this story, I was lost. I had a visual of, when I talked to my nurse unit manager afterward, I wished that the ground would open up and swallow me, because it was almost painful. And so in talking with my nurse unit manager, what I was able to learn and understand is that a couple of things, but that it's hope is risky for people risky to feel hopeful or to choose hopeful or put your hand out to grab hopeful, however you want to say it. It can be a burden. It can be very heavy. And I learned that as a nurse, that I could offer to hold hope for people and not take it from them, but just to hold it. And as a person feels able, stronger, willing, that it can be given back, as it were. And I never want to be flippant, I suppose, in saying, there's reasons to be hopeful, because for many, many people, it's a dark night of the soul. But I think the nurse's role in, as you've showed, in being willing to be, firstly, to be present, and to feel what it feels like, the intensity of that person's experience of not being hopeful or feeling there's no hope, to be willing to stand in that place with a person and to carefully and gently hold hope for them, because in your rational mind, that there may be reasons to be hopeful, but if a person can't hear that, and again, I draw on the majority of my clinical practice being within mental health. I liked that the person you talked about demonstrated that willingness to be there, because it was a teachable moment, and they were like, "Oh, I hadn't thought about that." No. They didn't shy away from it. No, they stepped into that space.
Yeah. But it's about I guess what I've witnessed too in the busyness of the health system, and particularly as it is today, sometimes we can lose sight of some of these softer parts of how we care for people, and hope is such an important, to be able to take the time as nurses, to be able to listen to people, to understand and give them hope for either, as I say, a future, or the end of their life, that it will be okay for them. Yeah. But because we're in this busyness and we have so many things to do, it's still important, I believe, to have that element in your practice.
Yeah. And when you mention about the softer things, I think that's what we talked about, I think, in the second story you shared about being and remaining human. It's about staying connected to our own humanity. And I often think that healthcare, there's a vulnerability if you like, to look at the differences, the things that are different between us as opposed to what's similar. And I think that if we are willing or have a raised awareness of the similarities, because they are far more. We all have a desire to be loved. We all seek shelter. We need food.
Comfort.
We need warmth. We need companionship.
Yeah.
And all of those things we share with every other human being, really. And the differences are much less. But I think there's a vulnerability that we are focused only on the difference. Perhaps, nurses are in that intimate, beautiful, professional position to hold that in balance. Because sometimes hope can look like, I'm here with you.
Yeah, exactly.
I will wait with you. Because, when people are receiving care, my experience has been they're very gracious toward nurses. Oh, but I know that you're busy. Oh, look, I've been watching you and you've got so much to do. And they're so forgiving and will make so many excuses. And to come back to your slowing down, but just to say, no, it's okay. I'm here with you now. And this is the time we're sharing.
This is our time. Yeah.
And I'm with you. I've certainly had people say to me that has been a hopeful thing. That made them feel safer.
Yep, exactly. And as in our first podcast, we talked about nurses being the glue to the system. Mm-hmm. So that glue keeps us all together.
Yeah.
Nurses actually keep it all together.
Yeah.
It's so important for us to take the time. And I know I understand in the business of our work, but take the time. We can actually provide hope when we're actually doing our tasks, when we're giving a medication, when we're doing observations, when we're, there's little things you can do like touch the patient. Are you okay? All those aspects where you can actually provide hope while you're actually giving their care.
Mm. So I think I'm a bit of a language is a big thing for me because I think it shapes the experiences that can unfold. When you say about taking time or making time, I think
making time.
Yeah, because I always feel like, well, the time is the time, and we're there and we're doing things, but it's how we're choosing to be in that time. And as you say, if it's giving a person their medication, it's how do we include that person? How do we do what we do and be who we be in a way that brings us alongside a person as opposed to doing but doing with and being with?
Yeah, I guess, like to me, just if we can give the example of giving a medication.
Yep.
So you're in partnership with the patient and you explain the medication. Mm-hmm. You ensure the patient understands what the medication's for, because at the end of the day, they'll be taking their own medication when they leave, but so it's so important that we partner with our patients when we're administering a medication, taking an observation, showing them their observations, explaining to them about it. That actually helps their health and well-being for them to actually understand all that. We as nurses have got that intimate knowledge to be able to share with our patients and their family.
Mm-hmm. And so perhaps then when a person has a sense of being in partnership, and then I'll call it a feeling of some control over what is happening, perhaps that then is linked to a sense of being hopeful.
That's right, exactly. So it all links, doesn't it?
Yeah.
So it provides that hopefulness.
Yeah. They're
confident that you actually know so much about them as while they're in your care. You know so much about the task or the clinical practice.
Your nursing profession.
Yeah, your nursing profession. And that gives them confidence. That gives them hope.
And at the same time, you are, and to use this example where you, of this person in your care, where you made the effort to be the primary nurse for this person, so you are learning and gathering parts of their story so that that's being incorporated into, as you said, the tasks that are doing or the things that are being done. I imagine that you are staying mindful of the context of this person's life. And I mean, I've had to be hospitalised. I've been a person receiving care, and I know how that feels when you feel like the person providing care for you knows a little bit about you, but it feels like they're in this with you. They're willing to be with you in this. It's quite a powerful feeling of, well, it's not a hopeless feeling.
No,
it's
no.
Not that anybody wants to be in hospital, but it's a comfort. But it also you feel less vulnerable.
I agree totally, absolutely. I guess I've got another story which I can share. So it was an afternoon shift and I was team leader. I was doing the round with the thoracic consultant. One of the patients, I actually was allocated patients even though I was a team leader in those days. Yeah. And it might even happen today. One of the patients had a mediastinoscopy and she had come directly from the emergency department to theatre for the test and then to the ward for post-operative care. So she was sitting up in bed. She'd been visiting Australia with her husband from overseas and whilst travelling across our country had become unwell and shortness of breath. So she was in a foreign land, so it was all a bit daunting for her. The doctor came and did a round and had spoken with her previously but had sort of rounded up his conversation, but I'm afraid your results are not good. You have a tumour the size of a football in your chest. That's very daunting. Yeah. You think about it. Put yourself in that patient's position. And it's inoperable. There's so many things in that comment. Yeah. And
you probably don't hear anything after that.
No, that's right.
Yeah.
Exactly. And I could sense that she wasn't processing this. This was he'd spoken with her before. Yeah. But this was just rounding up that conversation and her husband wasn't with her. She was by herself. So he said he'll follow her up tomorrow with a treatment plan, etc., to give that bit of hope. And then so I always believed that the role of a nurse is always so important to just take time to sit with the patient and assist the patient, support the patient in processing that information. I stayed with her and we both had fright in our eyes, I'm sure. I just sat with her and held her hand. In those times, silence says so much. I could feel all her energy drain from her body. She told me about her life. She then began to speak, actually, after we had silence, and she told me about her life and aspirations for the future. I can relate to all nurses who have the dilemma of having to care for other patients when this patient needed the nurse so much. It's not easy, and I had to process that in my mind. I had other people to care for and being the team leader for the whole ward, and yet that patient needed me so much to sit with her. It's actually a big ask, and it happens many, many times during the day, as we know. So I guess the point I'm making with this story is that, the dilemma of having to care for other people, but that patient needing and trying to prioritise all your tasks, and yet you had to sit there with the patient, wanted to sit with the patient to give her comfort. Yeah,
you recognise how critical it is to be there.
It was critical to be there.
Yeah. So
I guess that lady, she actually, she was in a foreign place, she was in a foreign environment, she had all this information, this massive tumour in her chest, and when they have that, they actually build up pressure in their head, etc., and it's pressure on their heart, lungs, their major organs, major arteries, etc. So it's a big deal. Anyhow, even that in itself is something to be, and to provide that hope for her that there is a process, or there is a plan for her for the future, is so important. So that did happen. She did have a treatment plan, and she had radium and etc. And she was actually able to have a good quality of life. She used to come back and see me, and she had a good quality of life in the future, which was so rewarding for me to see her coming back and saying, "Hey, I'm okay." But we spent that time together, so that connection we had was still there. Yeah.
And that environment that you describe, because I'm thinking, if you could bring others. I mean, I had a very privileged graduate year in mental health with a nurse unit manager who exemplified what I would call best practice and would drag me along, ask me to be and engage me in things whenever she could. And it's not always possible because, there is a lot that's going on, and, the nurse unit manager may, or the team leader in the community may not have that. It may just not be possible. But it does, I think, show the importance of sharing stories, talking about what it feels like to be a nurse so that others can learn from them. So whether that's in conversations that are planned and intentional, clinical supervision, reflective journal, and sharing those things. But it tells me that stories are incredibly important to share and to learn from. Can I ask you, when you think about nursing as a profession, what do you hope for? Do you have hopes for the nursing profession that you can share? I know I've just thrown this at you, but
well, I have great hope for the profession. There's so much wonderful work going out there every day in every setting. Look at the expansion of our practice in so many settings now to when I was working as a clinical nurse. It's quite amazing, really. So we have the opportunity to influence healthcare to so many in as I said, in so many settings. But the opportunity of advanced practice to work towards. So we've got a career structure that nurses can work from a novice practitioner to an expert to an advanced practitioner for their future. There's an amazing pathway there for them for their profession, and I think that that really needs to be continued to be strengthened by our leaders and allowing nurses to work to their full scope of practice. I still believe that even a registered nurse, a grade 1 registered nurse, has a very broad scope of practice. I do believe we need to really work and analyse that and support that practice in so many ways for the future. I'm so hopeful for the profession. It's an amazing profession. The privilege of caring for other people is just the most uppermost thing in my life, actually. Yeah.
All right. Well, thank you for sharing that. And as I said, was thrown at you a bit there. I particularly, listening to you speak, it's that the stewardship of something that is very precious, which is within our community, that we intersect with people at times of incredible vulnerability, when aspects of a life are starting to fragment, if you like, as health breaks down. And it's an incredible privilege to stand in those places and spaces with others in our community.
I think with our ageing population too, Beth, I think that you think about across the world, really, the aged person, that's really where they're most vulnerable and need to receive a lot of health care. But there's probably other ways we can do that.
Yeah.
Instead of actually bringing them into an acute hospital, caring for them in their home, in the nursing home. So this is where these nurse practitioners, advanced practice nurses, can come into the forefront. There's so much work to do to care for people, advanced practice nurses in the community, in all clinical specialties, mental health, all of the elements of clinical specialties that we have. The world's our oyster, actually.
Yeah.
And it's very, 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 I'm very hopeful for the future.
Fantastic.
It's going to be an amazing future for nurses. Yeah.
Ripe for reimagining.
Yeah, exactly. Yeah.
Thank you, Cheryl. This brings our talking together here to a close. We've shared 5 stories with you, wherever you're listening from, and we hope that as we go our separate ways, that we'll stay mindful of the stories that are within us, those that are unfolding, and those that haven't been lived and told as yet. So until next time, where we meet or find a path to each other's stories, this is Beth, and you've been listening to Nursing Stories from the Heart.
And until next time, this is Burnsy from Our Hearts to Yours.
Thank you for being with us today. And until next time, this is Beth, and you've been listening to Nursing Stories from the Heart.
And this is Burnsy from Our Hearts to Yours. We encourage you to share this podcast with your colleagues and friends, and we hope you enjoy them.
Do you want to tell them about your book?
Yeah, I'll tell them about the book. If you are finding value in these stories, and if you want to explore the history of my story, you can find my book, Memoirs of a Matron, in a bookshop. Your support helps us continue sharing these stories. I didn't really write the book to sell books. I wrote the book to tell my story and to let you listen to them.
And it's a great tale.
Thank you.